Okay, so we're gonna first of all, we'll do a review what we talked about already. The Corynebacterial diphtheria. I will be start to review, talk about this DTaP. And we mentioned about that this is a vaccine required in the United States for the kids since they are born after 2 months. So what are they? This is Corynebacterial diphtheria. Is that right? And T is Clostridium tetanus, and P is Bacterial pertussis. And we haven't mentioned about the T yet, but we mentioned about these two. So we're going to do a brief review. What are they? And they give you an idea. This Corynebacterial diphtheria, this is gram-positive. Is that right? Rods, and it's club shape. Now, they are usually for immigrant kids because they do not have the vaccine. So, non-vaccinated kids, usually it's a risk group. And what will be the symptoms we talk about is pseudo membrane in tonsil area. And we also see there is a very swelling lymph nodes will cause, we call, like a bull neck. So very sick neck. And we said that if we want to do a treatment, we have to do antibiotics with antitoxin, because this is a toxin. Since we talk about this toxin, this is the AB toxin. AB toxin coming from a series from a beta-phage. Long time ago, a beta-phage has been transferred or integrated the disease genome, which is a genome carrying the toxin into a bacteria, and then will stay there forever, then cause a problem. So this is called the lysogyny conversion. And the AB toxin, A is toxin domain. The toxin domain will cause inflammation. And the B is transmembrane domain. And the transmembrane domain will cause is bleeding. So that's what we talk about. Other than that, we said this one, you have to go to a CDC to report to CDC. And then you need to use a transport medium. And this transport medium is terorite blood agar. On terorite blood agar, which is actually sustained terorite blood agar, will show you black colony. Okay? So that's something we mentioned about. Now, Bacterial pertussis, we also talk about this. This will cause a whooping cough. A whooping cough usually is for 100 days newborn, which is cough, you have a respiratory gasp. And this is the one we usually do the testing is using PCR from a nasal pharyngeal swab, and which is actually a Dacron swab. So we could just say a Dacron swab. And the distance, the depth is about 2.5 distance of earlobe to the nose. Okay, this is something important for the bacterial pertussis. Then we talk about is major issue for the meningitis. And the meningitis, we mentioned this is age dependent. So we see if 0 to 2 months, group B Streptococcus acinetidea, we call it GBS. We will mention very quick. 2 months to 5 years old, HIV, hemophilus, influenza type B. So 5-year-old to 40-year-old, that means the adults. The adults will be the Neisseria meningitis. And we talk about the tough neck. And we talk about the vaccine for that. More than 40 years old, it will cause Streptococcus pneumoniae. And we will mention this real quick, the Streptococcus pneumoniae. And this guy, which is type B hemophilus influenza, is a fastidious bacteria. Which means they not grow on macanthi agar, not grow on blood agar, and only grow on chocolate agar. And they need, which is X and V factor both. And the X factor is hemine, and the V factor is NAD, nicotinic adenine dinucleotides. And they also have a centralite phenomenon showing on a blood agar, but with Staphylococcus aureus going to be growing there. Okay, so this is kind of like an outline of what we talk about. So give me some of the brief review. Now we're going to be major focus on a big topic here is Streptococcus and Staphylococcus. Now before we go, I said this slide is very important because blood agar we mentioned a couple of times. This is a differentiated media. Based on the hemolysis, so blood agar could be differentiated, become alpha hemolytic. A completely hemolysis, beta hemolytic, and nothing happens, which is called gamma hemolytic. So we want to talk about these using different examples. Okay, first one. Streptococcus pneumoniae. So I'm going to remove all these and focus on the Streptococcus pneumoniae and then all the others. There's a lot of the topic we could talk. Good. Streptococcus pneumoniae. First of all, Streptococcus pneumoniae, since it is a Streptococcus, it is gram-positive cocci, round shape, but it is very special. And we mentioned a couple of times already at our exam 1 even. This cocci is 2 of them stacked together. So we call it is a diplococci. You can see the picture there. It's very special. So we call it diplococci. And the cocci, which is surrounded by the hemisphere, this is capsule. This capsule could be due to the anti-phagosome status, which means they will break through the first defense of the host cell. So that's the characteristics. Now, what's going to be the symptoms for Streptococcus pneumoniae? Look at the species name, which is called pneumonia. So obviously, it will cause pneumonia. We call this 80% cap. What this means, this is responsible for 80% United States community acquired ammonia. Each represents one letter. C is community, A is acquired, P is ammonia. Okay, what is the symptoms for ammonia? Everybody knows it. You have a fever, you have a cough, and you may have a chest pain. And if you do X-ray, you will see a cloudy area in the lung. That's sometimes not really good. Okay, we hope it's only ammonia because we have antibiotics could be treated. That is typical symptoms for Streptococcus pneumoniae. And Streptococcus pneumoniae is alpha hemolytic, which means incomplete hydrolyze of blood cell. So what it looks like? Ideally, it is dark green color. Not really that obvious, but it is incomplete hydrolysis of lysis of blood cell. I won't say hydrolysis, I'll just say lysis. Lysis of the blood cell. Okay. Now, we want to talk about something. It is very interesting. Once we get Streptococcus pneumoniae, people coughing. So you use a cotton swab. You got from the oral cavity. Usually you say open your mouth, say ah, and then you put cotton swab. It's very interesting sometimes. You get a lot of other streptococcus. That's kind of thing we want to talk. When at the oral cavity, they could have lots of other streptococcus. Let's say Streptococcus bovis, Streptococcus mutans, lots of others. Then what we can do? And then you get a Streptococcus pneumoniae. They all looks very similar like a Streptococcus. This means it's a chain shape. Well, this is a diprococcal, and all these look similar. So what we do? We're using a very magic stuff called a P-disc. P-disc usually is add a disc containing antibiotics put onto a blood agar. And what's the components of the antibiotics is right there, is called opticam. Opticam. Once you put it there, they will have two different results. Streptococcus pneumoniae. What happened is looks like here. It is very sensitive to opticam. They will show in transparent zone. However, lots of other streptococcus, they will be growing surrounding it, which means it's going to be resistant. Resistant to opticam. This is the easiest way to differentiate Streptococcus pneumoniae and other streptococcus in your oral cavity. We gave them a name for all those streptococcus in the oral cavity. Is Viridine streptococcus. You can easily understand that it's a various different type of the streptococcus. Now, all these are important stuff. Yes, it's very important. And I want to tell you a very interesting story. You maybe heard about 70-year-old grandma to do oral surgery. And 1 week later, he died. Could be. What's the symptoms showed up? What's the reason? Viridine streptococcus. Because these Viridine streptococcus are very invasive. They could cause endocarditis, which is inflammation of heart valves. So that is very important. If anybody working in the dental office, at the dentist, when you see elderly people coming, the dental hygiene is very important, extremely important. The reason is failed dental hygiene will cause the contamination of viridine streptococcus. Now, how we differentiate that? We using is a P-disc called optic. This is what I showed them. Okay? And what are going to be the treatments for the ammonia? Well, you're going to have to using antibiotics, obviously. Using antibiotics. But do not forget what I mentioned. What's the best way to prevent infectious disease? Is always a vaccine. What's the vaccine for this one? PVC vaccine. The PVC vaccine is coming from the capsule of Streptococcus pneumoniae. If we go back to look at the scheduling, PCV vaccine, pneumococcal pneumonia, the PCV vaccine is using for prevent Streptococcus pneumoniae. And the kids is recommended to have shots, but not required. DTaP is required. MMR, mumps, measles, and rubella, all those are required. This is not required, but I highly recommend you do it. That's a PCV vaccine. Why we mention about the kids? This is very invasive bacteria, not only for ammonia. For the kids, you could have bacteria, semia, and septicemia. Bacteriemia, which means bacteria colonizing in blood cell, that's not good. Your bloodstream should be no bacteria. If your blood have bacteria, that's really bad. Septicemia, not only colonizing, which means they stay there, they also multiplication, which means they grow there. That is even gross there. That's even horrible. Okay, that's something is be careful. For the kids, Streptococcus pneumoniae not only cause pneumonia, they will cause otitis. What are the symptoms for the otitis? You have an ear pain, you have a buzzing, you have your own, think about that, everything is like a bee is surrounding your ears. Okay? That's called otitis. So very important, this pathogen needs to be controlled very well for the kids. So that's Streptococcus pneumoniae. So we have chest pain, antibiotics, treatments, immunization, sinus, which means you have a coughing and you have a sneezing. That's we mentioned. Now another thing I also want to mention, we just talk about that. Streptococcus pneumoniae for very old people, more than 40-year-old. Typically, it's more than 70-year-old. That will be cause meningitis. So remember, not only ammonia, could be has meningitis in older people. Okay, so that's important. Next one we want to mention is colobaciller pneumonia. Collapsible ammonia. Collapsible ammonia, this word is a little bit confusing. We talk about Streptococcus ammonia is the #1 community acquired ammonia in the United States. Collapsible ammonia, although it's called ammonia and the general name is ammonia, species name is ammonia, this is only responsible for 4% ammonia in the United States. So then, what is going to be this risk for? This is usually responsible for infant diarrhea. And then for urinary tract infection, called a UTI. What's the symptoms of UTI? Dysuria. Said very simple, it's difficult to pee. You have a burning feeling during go to restroom. You feeling it never ends. You feeling it's very frequency. Go to the restroom. That's called UTI, urinary tract infection. Tract infection. Okay, that's infant diarrhea. Now, how do we know Streptococcus ammonia comes out? A very special, interesting about the sputum sample. When you cough, you have a sputum sample comes out. This sputum sample is very heavy, a brownish color, looks like a currant jelly. Current jelly usually happens in the European country. Doesn't happens often very in the United States. So you can think about very similar to those grape jelly. So in the breakfast, you have a sliced bread. You cut it in half. You put a ham there. Some people doesn't put a ham, put cheese, and they put some a little bit of the grape jelly. You cover it. Look at the very purple smear, very sticky. That's called a currant jelly. Now, because of the symptoms, it's very interesting. When you grow on the blood agar, and you grow on the Macanthi agar, what it looks like? Looks like there's a cheese there. It's cheese-like colony. So we call it some mucoid colony. Looks like that. Very smear, heavy smear. You use a loop to put it, take it out. Look like a cheese. Mac and cheese looks like, you see? Because of what? Heavy capsule. Same thing. Now, another thing I also want to mention. We have this picture here. It's very interesting to know. The right side you see is a blood agar. That's no question a bacteria going to grow because it's an enrichment media. Unless it's a fastidious media, most of them will grow. Very sticky, look like cheese. Mucoid colony, no problem. Left side is a Macanthi agar. When you see Macanthi agar looks like, what tells you? So on the Macanthi agar, what it looks like? Look at the picture. It's growing there. Pink colony. What tells you? This tells you this is a gram-negative bacteria. This is a large shape. And why it is pink? Lactose fermentation. Positive. Very interesting. Very similar to the bacteria we mention all the time. Very similar to E. coli. The only difference, E. coli does not have the mucoid colony. And Klebsiella ammonium has it. But it's not really called ammonium. It's caused infant diarrhea and the urinary tract infection. Okay? So here are something we want to mention about. So Klebsiella ammonium. Next one, we will move on to a very special bacteria. And we have this one mentioned by all of you all the time. And I said before the pandemic, I teach different classes. And some of you will send me an email in the morning saying, Dr. Shen, I'm not going to come in today because I have a strep throat. Well, right now you're going to all tell me you're going to have a COVID-19 test positive, so you're not going to come in. That's okay. Before COVID-19 is always strep throat. What's a pathogen called strep throat? Streptococcus pyogenes. Okay, what is this one means? That's streptococcus, not a problem. Streptococcus. What's this one means? What does pyogenes means? PIO, which means pus. Dead white blood cell. What is genus means? That means genome. Will cause strep throat. Okay, when you look at the textbook, lots of you will write here is group A beta hemolytic streptococcus. It's kind of confusing. An acronym GAS. That's called group A strep. Even you go to see a doctor, the doctor will say, okay, group A strep, not good. Know what this means? So we want to tell you a story behind it. This is coming from a very important American microbiologist, Rebecca Lansfield. Rebecca Lansfield is a great American clinical microbiologist. Back in 1930s, maybe early 1920s, somehow by the time, he did a series of studies in rabbits. So he inoculated all these different types of the streptococcus into rabbit. And then get the rabbit blood cell. And basically is those liquid. Okay? When you get the liquid, what they do? They do an antigen-antibody precipitation study. Based on the antigen-antibody precipitation study, he grouping or mapping different streptococcus into different groups. It is a long list, but at the end of the day, we will be dramatically using is the three groups, which is group A, Streptococcus pyogenes, and group B, we mentioned already, Streptococcus agalactiae, and the group D, Enterococcus facilis. That is a major three group. Now, how about this guy? Streptococcus pneumoniae. They did not belong in any of the group. Why? Remember, we talk about this one. Fluid mosaic model of the cell membrane system. She find group A, group B, group D. At least you have an M protein there. However, Streptococcus pneumoniae, no M protein. Therefore, Streptococcus pneumoniae does not belong to any Rebecca Lansfield group. Later on, people think you're very smart, you know about it. And in the clinical area, we want every person could be understanding about this category. So, until today, they gave Streptococcus pyogenes, they call it GAS. Streptococcus agalactiae, they call it GBS. Enterococcus facilis, they don't call it GDS. A little bit special. And these two, until today, they talk about. Okay, so that's very interesting. There's a long story behind it. Okay, Streptococcus pneumoniae, what are they going to be looks like? Streptococcus pneumoniae, the risk group, is kids 5 to 15 years old. That's a risk group. It's not you guys. So when you ever send me email say you have a strep throat, I'm usually laughing because most likely it's a virus. It's a flu virus most of the time. Because the risk group is 5 to 15 years old. These type of person usually have strawberry tongue. You open your mouth, your tongue, you see those red dots look like a strawberry surface. It's very interesting. And I want to tell you, this pathogen is very invasive. At the beginning, you usually see the skin surface is crushed, they have one dot there. That is called Tigo. That's a very surface contamination. And then later on it will be penetrated. So what happened? You see these tissue area, lots of the stuff like this, like a bee house. That's called cellulitis. That's the second stage. The third stage is low tonsil area, strep throat. Looks like a picture there. Strep throat. So strep throat is a second stage, a third stage. Once you have this stage, people will do antibiotics. And I want to tell you one thing, lots of the people right now in the clinical industry, if you go to see a family doctor, you said you have a cough fever, what they do? They put a cotton swab inside to do a rapid testing to see whether you have a strep throat. If you have a strep throat, they will give you antibiotics. If you don't have it, stay at home for 7 days because it's maybe flu virus. Obviously, these days they will add another test, which is COVID-19 test. But it's still the same thing. They're not going to do anything for the virus. If it's bacteria, strep throat, give you antibiotics. Just want to let you know, okay? Now, if we do the antibiotic treatment, does that mean we are all good? It depends. Lots of the people will have a follow-up symptoms. That's called post-streptococcal disease. We gave them a terminology called sequelae. Number one, rheumatic fever, which means you have a fever with joint pain. Number two, glomerulonephritis. This is very bad. Glomerulonephritis, what this means? Your kidney membrane system is a filtration system, which means glucose, protein, amino acids, all kind of nutrition stuff should not be showing in your urine sample. However, if the glomerulonephritis happens, the kidney filtration membrane system is damaged, you will see a protein, glucose, blood, all kinds of nutrition stuff is in your urine samples. That's not good. It's potentially will be damage your kidney. So that could have those sequelae, which means post-streptococcal disease, glomerulonephritis, and rheumatic fever. Okay, so those two are very important for you to understand about that. Next one. We finished talking about here. We want to focus on this guy. Streptococcus agalactiae. Streptococcus agalactiae, which is a group B streptococcus. It's not very often happen for adults. This happens is for newborn. Because the newborn baby could be infected with this pathogen from the pregnant woman. And where it goes? It goes placenta. So, in the United States, they require the pregnant woman at 35 to 37 weeks have to do a screening test. Of GBS. If the woman has been tested GBS positive, they have to using antibiotics. Otherwise, the newborn baby will have meningitis, septicemia, and bacteremia. It's very important to risk group. So, Streptococcus agalactiae, the group B, is important. It is a risk for newborn baby. Now we back to the question. I had group B Streptococcus. I had group A Streptococcus. How we differentiate it? Because both looks like very similar. It's beta hemolytic. It is a chain shape, gram-positive coccell. How we differentiate it? Same thing. We using a blood agar. And this time the blood agar also containing an antibiotic disc. But we call it an A disc. What's the components of the A disc? Is basic tracing. The function for the basic tracing is to killing a bacteria. Said very scientifically, it inhibits bacterial growth because they will prevent the metabolic precursor go to the cell membrane system. We will mention this later on. But the results is very interesting. Very similar to the P disc. Streptococcus pyogenes, we call it a GAS, susceptible or sensitive to the A disc, will be showing the transparent zone. How about GBS, the Streptococcus agalactiae? This guy is resistant. Which means GBS is resistant to basic tracing. Okay, that's very interesting. That's using a P disc and A disc could differentiate Streptococcus pneumoniae versus Viridam Streptococcus, which is P disc, and using A disc containing basic tracing, so they could differentiate Streptococcus pyogenes and Streptococcus agalactiae. Very simply say, could differentiate GAS and GBS. And that's what the picture looks like. Okay? Okay, next one we're going to move on to is Staphylococcus. And we have this guy I haven't mentioned yet. We'll talk later on. Okay? So we finished talking about Streptococcus. We want to talk about Staphylococcus. I will make your life a little bit easy, not going to be too complicated. Staphylococcus. And we mention this pathogen all the time, Staphylococcus, what it looks like. Gram-positive, coxile, obviously it is grape shape. Looks like a grape. We will do this in the lab as a gram stain. Okay, you have an idea what it looks like. Okay, what do we really care about? Talk about Staphylococcus. We care about three things. Number one, Staphylococcus aureus. Staphylococcus saprophyticus and the Staphylococcus epidermis. These are the three things we are interested about. Okay, let's talk about these one by one. Let's talk about this guy first. Staphylococcus epidermis. We don't worry about this too much. This is usually retreated as normal bacteria on skin surface. So last time I said on your skin surface, there is a Staphylococcus will be survived because you have more or less have some salt gonna come there. The salt actually is killing bacteria, but Staphylococcus survives, so we call it a halophile. Now, majority of the Staphylococcus on the skin surface is epidermis. I mean, that makes sense. That genus name said epidermis, which means on the surface. So, we say this is a normal bacteria on the skin surface. Okay, that's easy. Second one, Staphylococcus saprophyticus. This one, we call it a honeymoon bacteria. What is honeymoon bacteria? This risk group is 25-year-old, sexual activity, and a young girl, female. What's the symptom? Abdominal pain with UTI and abnormal period of time bleeding. Sexually transmitted disease. So we have a joke there before, which means there's a young lady who is like 22 years old. One day she will talk to her mom, said, I'm not feeling very well. I have abdominal pain, I have a urinary tract infection. So they go to see a doctor. The doctor do a very quick test. Then he gonna ask the mom, said, did you notice that maybe you your daughter had a sexual transmitted disease, and then the mom think about it, a couple of nights she's not at home, that could be the reason. Why? They could do a very quick test to identify Staphylococcus aureus. This is going to be resistant to low dose novel biosyn. It's another antibiotics, and all the other Staphylococcus will be died. So that's very interesting, okay? So these two we finished. We want to talk about that guy. Staphylococcus aureus. Number one, what we care. So we want to show you slides. Staphylococcus aureus. Did you heard about MRSA? I believe so. What is that? Methicillin resistant Staphylococcus aureus. MRSA. What happened? We know people using antibiotics created in 1950. They're widely used in all kinds of infectious disease. Using too many. They created penicillin G, penicillin B. They find they have some advantages or have some disadvantage. For example, penicillin B, you can only do muscle injection. So they move on to penicillin G. Penicillin G resistant to the stomach acid. Okay, they find the penicillin B and the penicillin G using way too many, generate antibiotic resistant. They have another new generation comes out, which is methicillin. They think methicillin will be safe to use. However, it's used way too much. So Staphylococcus aureus become methicillin resistant. We call this kind of the symptom, the problem coming from the hospital. So this is a hospital acquired Staphylococcus aureus. We gave them a name called nosocomial infection, which is hospital acquired. The only reason is carelessness. People don't take care of the cleaning, hygiene, and everything else. Disinfection. They just keep using methicillin. They think it's a magic tool, but it's unfortunate it's not. Okay? Second thing what we want to mention is food intoxication. Chicken salads. What is food intoxication? You eat some food contaminated by certain bacteria will generate a toxin. That toxin is an exotoxin. They are resistant even to the heat. So you cooking it. The bacteria died, the toxin is still there. What is the risk group for Staphylococcus aureus chicken salads? Chicken salads is very cheap. You buy from Subway, $5. Sometimes a coupon, $2, $3 for one each. How do people prepare it? They are six kneading like this, like that, and touch the salads, touch the chicken. That is a favorable environment for Staphylococcus aureus to grow because the nutrition there. And you sneezing, you're coughing, you go there, they grow in the chicken salads. And what happens if you eat it? The onset time is only 5 hours, sometimes 3 hours even. You have a vomiting, diarrhea, nausea, all those things happen. And very ironically, is Staphylococcus aureus happen on chicken salads, you don't have to report to CDC. But will make you very uncomfortable. So as a microbiologist, I barely eat chicken salads because that's a cheaper one, but it's very much risk. You look at the chicken salads, sometimes there's other ingredients that they're all favorable for bacteria to grow. Really nice. In my other class, which is for the microbiology lab, we can isolate Staphylococcus aureus from the commercial chicken salads, which is from the Evansdale Library. Usually have a cafeteria, then they get it done. I just got the 3 samples there. I have 1 sample isolated Staphylococcus aureus. Before pandemic, since pandemic, I never did that. Very interesting, so I'll tell you. Okay, that's food intoxication for Staphylococcus aureus. But Staphylococcus aureus, why it makes it famous is this guy. This is the one makes it a hot topic. Toxic shock syndrome. TSST1. Toxic shock syndrome, toxin 1. What happened? A brand called Riley tampon. This is a horrible material, Riley tampon. In 1970s, this product temporarily is very welcomed in the United States. Women using in a period of time because it will make you comfortable. It is highly moisture absorbent, but it generates a problem. And we need to know in the vaginal tract, the mild moisture there and also the low pH is very nice for certain bacteria to grow, which is lactobacillus. This is a protective bacteria in the vaginal tract. And you are using highly moisture absorbent tampon. This is gone. And all the other normal bacteria in the vaginal tract is died. Then Staphylococcus aureus become dominant. Then what happened? The toxin is there. So the toxin will go to a bloodstream. Okay, when you go to the bloodstream, what will happen? Bloodstream originally should have a pressure. The pressure goes on to these liver, kidney, or these organs. If you have a bloodstream have Staphylococcus aureus, they carry on the toxin, it's very invasive, they will dramatically lower down the blood pressure. What this means, you will have a opposite way of the hypertension, okay? Which means not enough blood go to the liver, go to the kidney, they will start to decay. And what happens for the human being? You have a coma. It's called a shock. So that's a toxication shock. Riley tampon products killed about 13 women died. Another story says there's 10 women died. At least about 3 to 13 women will die by the time they use their products. So after 1970s, this product is out of the market. I don't have the sample here. In my old school, my first job at Western Kentucky University, I used to have one of the sample. Back from 1970s, the older professor left for me to teach that, to show people every time when I teach clinical microbiology. It's a horrible material. Okay? So that's very interesting. We talk about all this stuff. Now, we want to have a last table, and then we will off today. Okay? What's the table we want to talk about? We talk about the Staphylococcus aureus. Staphylococcus aureus, epidermis, saprophyticus. How we differentiate it? It's very interesting. Okay, Staphylococcus aureus. Staphylococcus epidermis. Staphylococcus saprophyticus. How we differentiate that? We're using several things. Number one is mannitol salt agar. Obviously, they all grow. But what's the difference? Staphylococcus aureus is yellow colony. Mannitol fermentation positive. Staphylococcus epidermis and saprophyticus is colorless because they are mannitol fermentation negative. They're using mannitol salt agar. Second, they could use blood agar. What it looks like? Staphylococcus aureus is beta hemolytic, transparent zone. Staphylococcus epidermis saprophyticus both gamma hemolytic. Nothing happened. Okay. What else? No bouncing. And I told you a joke. Why the doctor knows the lady has Staphylococcus saprophyticus, has a honeymoon bacteria? Because Staphylococcus saprophyticus is resistant to novel bouncing. Staphylococcus aureus epidermis is susceptible. So it's not going to grow. Another thing we want to mention, Staphylococcus aureus have a very special, they carry on coagulates. Coagulates could cause blood cell clotting. Basically will make the blood cell looks like a jelly. So coagulates test. Staphylococcus aureus is positive, both of these are negative. That's very interesting results. Now, there's another question. You talk about Staphylococcus, you talk about Streptococcus. How we differentiate it? Lots of people say we do gram stain. Both of them gram positive, coccell. One of them grape shape, another one is chain. Can you really see it? I tell you, very difficult. What we do? We do a catalase test. Very simple, quick test. On glass slides, you draw a circle, you put a bacteria, you add H2O2. Because H2O2 could be hydrolyzed, use catalase, become oxygen and water, the oxygen will be bubbling. You see a beautiful bubble there. I will show you. What is the catalase test results? Staphylococcus, positive. Streptococcus, negative. What this means? This is bubbling. This is no bubble. But be careful. This test cannot do on blood agar. Why? Blood agar has heming, has hemoglobin, has oxygen. If you did on the blood agar, whatever you do, it's bubbling. Now, why we want to mention the blood agar? In the clinical areas they used. You have a sputum sample, you streak it. You see beta hemolytic, alpha hemolytic, is that right? Then people think, okay, let's take it easy. Put a couple of drops of the H2O2. Never bothering that, because whatever you do, it's going to start to show the bubbling. So the tricky, never do catalase test is on blood agar. Okay? So that's what I all have for today. And Thursday, Corey will give a guest speaker for the chicken feeds microbial safety. and the silvering activation. And the next week, Tuesday, we're going to talk more of the bacterial disease. We will have another conclusion table to talk about Staphylococcus and Streptococcus. Okay, so that's all we have.